All right, we are wrapping up chapter 3 by talking about injury and aging of tissues. So we're going to talk about the cardinal signs of inflammation, talk about the body's response to tissue injury and how it repairs itself, and then we're going to touch just a little bit on the impact of aging on different tissues and potential cancerous mutations effects on that as well. So, inflammation is the standard and kind of first line response of the body to injury and frequently infection as well. Inflammation's goal is to kind of limit how extensive that injury is and keep it from getting further than it needs to. We really want to limit that injury and keep it as contained as possible. Inflammation is also going to either partially or fully eliminate the cause of that injury, depending on what caused that injury initially, and it is going to help signal the initiation of repair and regeneration of that damaged tissue. So we do want to fix that injury. Inflammation kind of comes from certain types of cell death. So we've talked a little bit about apoptosis before, that programmed cell death, where the cells reach the end of their life cycle or recognize that they've been infected with a particular pathogen and undergo certain processes that lead to that cell death. And this is not going to cause inflammation in the body because this is a very natural process to have happen in our body. Necrosis, on the other hand, is accidental cell death, so cell death that is occurring when it shouldn't, and this is what's going to lead to a lot of this inflammation. All right, so 4 signs of inflammation, these are the 4 cardinal signs of inflammation, are redness, swelling, pain, and heat. Sometimes loss of function can also accompany these, but that is not always going to be the case, and that loss of function can be temporary, or in some cases it can be permanent. But that is not always going to happen, whereas these 4 cardinal signs are always going to be present with inflammation. Right, and we've all experienced this at some time or another. We've all twisted our ankle or gotten a pretty bad cut or something. That area is going to get a little bit red. It's going to start swelling a bit, sometimes a lot. There's usually going to be some level of pain associated with it, whether it's a small amount or a large amount. And then it can also be very warm to the touch, so warmer than surrounding tissues that are not currently injured in any way. So once that injury occurs, and it's been contained by that initial inflammatory response, then the body is going to start working to repair that tissue injury. All right, and so we are going to go through some different steps of this tissue healing. So as soon as that injury happens, those damaged cells are going to release special chemical signals that cause something called vasodilation, which is blood vessels are going to expand. They're going to stretch a little bit. All right, and that is going to increase blood flow to that area, and that's how we get that increased redness and heat happening, is more blood flow is coming to that area. And then also in response to that injury, we are going to have certain types of cells called mast cells that are going to start releasing a vasodilator, a chemical that causes that widening of the blood vessels called histamine. These also function as part of our allergic reaction response. So many of you probably take an antihistamine, like Zyrtec or Allegra or Claritin or something like that. Those are all antihistamines that are trying to block the action of that histamine. And in the case of an allergic reaction, that is what we want because the body is reacting to that stimulus unnecessarily. It should not be reacting to that. We'll touch on that a little bit more when we do the immune and lymphatic system. But in the case of a tissue injury, histamine is really, really beneficial to get those blood vessels to widen so that we have increased blood flow to the area, which means we're getting more oxygen delivered to that site to help fuel the cells, as well as nutrients, and it's helping to remove waste products from that area. So we really do want that increased blood flow in the case of an injury. All right. That increased blood flow is also going to bring other immune cells with it that are going to help starting to repair that injury. And then we're also going to get platelets coming as well, because if there is damage to a blood vessel, then we need the platelets to help repair that. All right. And so we are going to get all of that blood flow and other cells coming to that area. That vasodilation is also going to kind of increase the permeability of blood vessels, allowing more cells out of the blood vessels to that site of injury, so that they can get out a little bit easier than they would normally. They can still get out of them, but widening the space in between the cells in the blood vessels is going to help speed up that process. All right. So we're going to get special types of cells like neutrophils and macrophages to that particular space, as well as some extra fluid, and that extra fluid moving there is what's causing the swelling, or edema is the technical medical term for it. And all of that swelling and kind of increased blood flow is what is ultimately going to put pressure on certain nerves in that area that are going to signal the sensation of pain. So that's how we get those 4 cardinal signs of inflammation. All right, there are some other chemicals like prostaglandins that can also activate those pain neurons, and so some medications that we take for that, the non-steroidal anti-inflammatory drugs, also known as NSAIDs. This is things like ibuprofen or naproxen, so Motrin and Aleve. Those are NSAIDs, as well as aspirin. They inhibit prostaglandins, and so that's how they can help reduce pain. So those drugs are best used in certain situations, but not necessarily others, because of that action of inhibiting prostaglandins. So this can also help reduce some inflammation, as well as the use of antihistamines can help reduce that inflammation as well. But again, we don't really want to reduce inflammation too much in the case of tissue injury, because we really want to be repairing that tissue. All right. Once the injury has kind of been contained, we've got all of our cells needed that are in that area, then we start the repair process by first removing toxins and waste products, debris, things that are not supposed to be there anymore. We need to clean that up and get it out of there. Again, clotting or coagulation is going to help reduce any blood loss from damaged blood vessels. That's going to produce a network of fibrin proteins that will trap blood cells and help kind of adhere the edges of the wound together. So we can see that happening here in this kind of middle image right there. All right, so we want to stop that blood flow. We want to keep our blood in our vessels where it's supposed to be. All right, and so that is also going to help start to close that wound and kind of bind the edges together to keep it from getting worse. All right. We're also going to see the fibroblasts helping to produce collagen, which is going to further help repair that tissue. So collagen and the extracellular material lost from that injury is going to help kind of start restoring the basic structure of that tissue and give all of the other cells something to build off of. All right, and this is sometimes called granulation right here. Some of you may have dealt with some granulation on like piercings and things. That can cause some of those bumps. They're not always keloids. Sometimes it's granulation. And that will clear up on its own. Keloids usually won't. So as we're starting to rebuild that scaffolding, we can start getting other cells and structures into that area to start rebuilding. And so that granulation tissue shouldn't really stay around too long. When we get too much granulation tissue, that's where we get scar tissue from. And then as you can see, there's not really any other structures going into it, so blood vessels are actually not going to be able to kind of grow through that particular area. And that's how we get scars. Obviously, some scars are going to stick around long term, potentially the rest of our lives. Some of them will slowly fade over time, so this process can take years to fully repair some of these sites of scar tissue, depending on the type and severity of that injury. All right, and so we can have a couple different types of wound healing, primary and secondary unions. So primary unions are going to be when a wound has the edges closed together, and then that's usually not going to result in a scar, so we're not seeing the process diagrammed here in this slide, whereas a secondary union is going to be when we get these gaping wounds and we're having to fill that space with that collagen and some other cells, and so that is where we're getting those scars from. Generally speaking, if there's an injury that is more than about 1/4 of an inch deep, stitches are recommended to help kind of promote that primary union to happen and reduce the chance of scarring, and also allows better regeneration of that tissue. If you can pull those two edges of that wound back together, then we're not going to have as much of this collagen deposition happening, and we'll have a lot more restored function usually, as well as the reduction of a scar. All right, we'll just look at this briefly while we talk about tissues and aging, or this is probably more entertaining to look at, so I'll leave it here. So as we get older, things are going to start slowing down. Cells, tissues, organs are impacted by something called senescence, which is the deterioration of those structures with age. The speed at which this happens varies greatly depending on genetics and lifestyle, so no two people are going to age exactly the same, but they are still going to age. That just happens. Our body cannot keep going forever, because our bodies are not designed to do that. So obviously outward signs of aging are pretty obvious. So skin and other tissues start getting a little bit thinner and drier. They're not as elastic. That's how we get wrinkles. That also contributes to the development of high blood pressure, as those blood vessel walls start getting thinner and not as elastic. There's going to be a lot more stress put on them because they're not able to stretch as well, leading to high blood pressure. Gray hair comes from the follicles producing less melanin. Melanin is a pigment that gives our hair and skin different shades, and so that is going to get produced less and less, causing hair to slowly turn gray. And then that elastic and collagen fibers start decreasing, which further kind of makes our skin wrinkle and start sagging a little bit as it's losing its structural support. Again, because we're just not able to keep repairing indefinitely, at least not at this point in time. Who knows what will happen a couple hundred years from now, but as of right now, this is how things work. Other structures in the body, like the eyes and ears, because of a lot of use over the course of our life, exposure to different environments and stuff like that, those structures are going to not work as well any longer. Those connective tissues slowly start to break down, and they're not going to repair themselves as well. Cartilage that we talked about in a few videos ago, that is something that really does not repair itself, because if you remember, cartilage is avascular. It does not have a blood supply, so there's nothing to help keep bringing nutrients in. So it does not really repair itself. We also start to lose calcium and other minerals from our body, which makes our bones less dense and more prone to breakage. And then less fluid is going to be in the intervertebral discs in our spine, and so those are going to start collapsing and bulging. That's how we can get herniated discs. There's other reasons to get herniated or bulging discs, but old age is a very common one because they're not as fluid. They don't have as much of that fluid in them for that cushioning, so they're not providing as much cushioning, and they can start kind of slipping out of place. Muscle tissue start kind of losing mass through a process called atrophy, and that's just a natural process as we get older, but it also happens as a result of decreased usage of those muscles. So use your muscles a lot, and that will reduce the stage at which that atrophy process starts. If you're continually using your muscles, it's going to take longer for them to start atrophying just from age alone. All right. There's a lot of other things that are going to happen, but basically everything in our body is going to start losing elasticity, structure, and mass because we just cannot keep maintaining and repairing as well as we used to. So those stem cells we talked about last week, they can continually divide, but even they kind of have a limited lifespan, and at some point they're not really going to be able to keep making copies of themselves to produce more stem cells to send out to different levels of the body for different structures. All right. Again, a lot of those signs of aging are external that we can visually see, but there's a lot that go on inside of our body that we don't see, and therefore we're not really thinking of. So the frequency of heart disease and respiratory conditions, type 2 diabetes, all of those can increase with age because our body's not functioning quite as well as it's supposed to be, as it did when we're younger. Not all of these are necessarily going to be exclusively age dependent, so they're not just going to be based on age. Obviously, lifestyle is going to have a big impact on a lot of those as well, but age can cause these a lot, especially the heart disease and respiratory issues. Wound healing gets slower as we get older because, again, our body's just not able to go through this process as effectively or as quickly as when we're younger. Higher frequency of infection because our immune system's losing its ability to fend off from pathogens, which is why vaccinations and regular medical checkups are super important to kind of survey and prevent a lot of those pathogens. And then even our cells at that cellular level, the telomeres, the parts of chromosomes necessary for cell division, those start shortening every time a cell divides. And so as cells divide more and more and more, they slowly lose their ability to divide and regenerate themselves. Cell membrane's also going to change and be less able to transport oxygen and other nutrients into and out of the cell, remove waste products and stuff like that. So this is really a widespread impact, and obviously this is all going to happen very, very gradually as we age, but our bodies have a limited shelf life. So that is kind of that process of aging. And then cancer is also going to be a lot more common as we get older because those cells are not able to maintain all of their structures appropriately. And so those checkpoints aren't going to function quite as well as they once did, leading to an increased risk of cancer developing. All right, and on that super fun note, that wraps up Chapter 3 on tissues. So, as always, let me know if you have any questions, and we'll be back next week with some more videos.